Good morning friends. Vitamin D is also called as a sunshine vitamin because it is formed in an active form with the sunlight, that is specifically the UVB rays of the sun, which converts the vitamin D2, which is Ergocalciferol, to vitamin D3, which is the Cholecalciferol, and the active form of the vitamin D. The two specific organs which are important in the metabolism of vitamin D are liver and kidney. Now, with this video, I want to emphasize that vitamin D is a very important nutrient, and it is important not only for the bones, but it is also important for certain extra osseous things. Namely, vitamin D decreases the risk of cardiovascular accidents and heart attacks significantly. It also decreases the risk of heart failures. It decreases the risk of neurological catastrophes like stroke. It reduces the incidence of respiratory infections, viral infections, and chest infections. So it is a role in increasing the immunity. It also decreases the risk of dementia and Alzheimer's disease. It also reduces the risk of diabetes mellitus, and it also reduces autoimmune diseases like SLEs and others. So it has got a plethora of effects, and it is a very important essential nutrient in your body. Important osteo effect, that is the important bone effects, are pertaining to both bones and joints. And those patients who are adequately supplemented with vitamin D have a significant reduction in fractures. So those patients who are supplemented with vitamin D have a 15% reduction in the overall fracture rate and about 30% reduction in the hip fracture rate. The vitamin D is converted to 25 hydroxy vitamin D in liver and to 125 dihydroxy vitamin D in the kidney. So the kidney performs or makes the active metabolite of the vitamin D. Also, in the pleiotropic effect, that means that the effects which are pertaining to bone, affects other than bone, there is a enzyme which is called as a CYP27B1 enzyme, and this is present in all the cells of the body, and this also can synthesize the active form of the vitamin D. Now we will come to the dosage and the requirement of the vitamin D in the body. So for the osteoarticular effect, the recommended dose of vitamin D or recommended daily intake of vitamin D is around 400 to 800 international units per day, and we want to achieve a target vitamin D level of 20 nanograms per milliliters. So if we can achieve that, we will be able to prevent fractures, and we will be able to prevent the low dose effects of vitamin D like rickets and osteomalacia, which essentially means that your bones are soft and weak, and which are prone not only to fractures but also will cause deformities and pain. Now, rickets and osteomalacia, rickets is specifically seen in young children and osteomalacia in an adult. But when we are talking about the pleiotropic effects of vitamin D, that essentially constitutes of extra bone effects of the vitamin D, then we need to maintain a vitamin D level of more than 30 nanograms per milliliters, and we need to supplement vitamin D in a dosage which is approximately higher than the bony dosage, and that is around 400 to 2000 international units per day, depending on where you live and how much your sunlight exposure is. The best natural way to get vitamin D is sunlight, and you ideally should be exposed to vitamin D about half an hour, and the early morning sunshine is said to be the best mode for a vitamin D synthesis in the body, and you should have the body which is exposed to the sunlight. You should not be wearing clothes, and the UVB rays are the best. You should not be also applying any cosmetics which prevent the UVB rays from reaching to the skin levels. Now till 2010, the recommended vitamin D dose was only 2000 international units per day. But after that, a lot of papers came up with the support of vitamin D role in a plethora of tissues in the body and lot of cells. So after that, the recommended daily dose of vitamin D has been increased. Now it is around 200 international units per day in infants and children who are less than 1 year. In children and adolescents, the recommended daily intake is around 400 international units per day. In adults, it is around 400 to 600. And in elderly, specifically those who are more than 70 years of age, the recommended daily intake is more than 800 international units per day. Now, when you are treating a deficient state, so if your patient is deficient in vitamin D and you have blood reports which are suggestive of a deficient vitamin D, you need to give vitamin D in a higher doses. Now, what are those doses? If you want to treat therapeutically a neonate, you should give a dosage equivalent to around 1000 international units per day. If it is a children, you can do around 2000 to 3000 international units per day. In an adult, you can give around 7000 to 10,000 international units per day. You can also give a pulse therapy, that is around 50,000 to 60,000 units per week you can give as a treatment modality or a treatment dosage. Occasionally, patients have malabsorption syndrome or some problems related to absorption, intestinal problems or problems related to absorption. Then you can give it twice a week as it also. So that means 50,000 to 60,000 international units, and you can give it up to 2 times a week. If a patient is obese, then the requirement is high. So if in an obese individual, you might need to increase this dose. Now, usually it is a very, very safe vitamin supplement, but occasionally there may be some side effects. The 2 most common side effects are hypercalcemia, which is very rare and can lead to some problems. And occasionally you can have stones, which is also called as a nephrolithiasis, or which is also called as a kidney or renal stones. We have seen this very, very rarely in our clinical practice, but you should be aware of this side effect. Also, there is one very important phenomenon that you must understand. Many people get serum calcium levels done as a marker of blood calcium level or adequacy of calcium supplementation. So that is a wrong notion. Now, serum calcium level is a level which is very, very tightly moderated with the body. Now, serum calcium level will be maintained at 2.45 to 2.65 millimoles per liter, irrespective of the level of calcium in the body and the level of vitamin D that you take. And it will not be altered because a body needs to have a very stable calcium levels in the blood for its functioning. So, a serum calcium level or a blood calcium level is not a good marker for the body calcium levels. The better test to do is a serum vitamin D or hydroxyvitamin D levels, and as I told you, the levels should be for bony well-being more than 20 nanograms per milliliters, and for overall well-being it should be more than 30 nanograms per milliliters. If you have any more questions regarding vitamin D supplementation or calcium vitamin D homeostasis, you can write us on the comment box. We'll be very happy to answer you. Thank you.